So really the first place we start really has to be a really thorough structural exam of both the eyes and the brain. And the reason why this is so important is there are other diseases and other problems that can also create visual symptoms like patients with visual snow syndrome have. And if it's found that there are those structural problems or disease-based problems, that is where really treatment needs to start. Sometimes VSS patients come in to see me and they're super frustrated that they've done all this testing and everything's normal. But really, this is the best possible answer because now they know they're healthy and structurally everything is normal. So now we can really get to work. Our testing then starts with a functional evaluation. Sometimes we call this a sensory motor evaluation. So we're trying to evaluate why you're having symptoms and where is it going, where are your symptoms coming from? Double vision, flickering vision, etc. So let me give you an example of what the visual system looks like. If you imagine that you're standing on a corner and you're about to cross the street, off to the side you notice something moving in your side vision. This is called peripheral vision, and this stops you from moving, from stepping into the street. You then take your eyes and move to look at the target, and you realize, oh, it's bus number 23. This is the central part of your visual system. So vision's all of that. Most, actually all eye doctors, look at the central part of vision. What is it and is it clear? What's really important is peripheral vision, the movement part of vision. Because sometimes what can happen is the central part of vision and the peripheral movement part of vision become imbalanced, and this often is the source of a lot of the visual symptoms that patients with visual snow syndrome have. We also look at patients' posture because if a patient has visual information that's going to the brain that's not correct, sometimes patients will do postural changes to adjust for it. And if we can assess the postural changes, then I know that we can use prisms and lenses and some therapy to really get their system back to balance, which then brings them back to function. So these visual exams tend to last between 60 to 90 minutes. And we're doing things like examining one eye at a time, doing eye movement tasks. We often look at both eyes together, doing eye movement tasks. And we also look at how the eyes coordinate together as a team. Can our eyes look far? When our eyes look close, they need to move together and they need to sustain this fixation and then it needs to move. Sometimes patients' visual systems don't allow this to happen, and if the eyes can't sustain looking close, this is sometimes where double vision can occur. We also look at how the eyes shift focus from far to near, and we look at how the vision processes the visual information as it comes in. There's so many tools that we can use to test and evaluate, high tech and also low tech. And most of us will start at where the patient can, and we'll use the technology that we have based on when the patient's ready for it. So what I mean by this, some of my visual snow patients come in and I start doing my exam and I notice there's a certain level of discomfort that happens. If already discomfort sets in, I often won't choose to do the higher tech equipment-based stuff because I know the discomfort will be tremendous and overwhelm their visual system. So we come back at a later time and revisit the higher tech when their visual system's able to support it.